Good afternoon, everyone, and welcome again to Bamboo Wealth Financial Planning Does Matter. My name is Sam Tabit, your host, and today we'll be discussing health and mental well-being. We have a special guest, Sasha, Carey from AIA Vitality. First of all, I wanted to provide a disclaimer, as we normally do, that the information we're providing today, as usual, is for general information. It's for providing you some guidelines, but essentially it's in your best interest to ensure that you seek medical attention if need be. But if you do also need personal financial planning advice, please come and see us or go onto our website and you can make an appointment through that. But essentially, we wanted to provide you some backdrop to what's happening in the financial markets and the economy, and also health, which is very important to building your wealth. So without delay, I'd like to introduce Sasha Carey from AIA Vitality, who is a wealth coach. I'll ask Sasha exactly what that actually entails. Sasha, thank you very much for being with us today. How are you?
Very well, thank you. Over here in glorious, not so sunny Melbourne, although the sun is shining today. Not too bad. Thank you for having me today.
You're welcome. Sasha, I just thought maybe we could start off by, if you could provide us a background, what you exactly do at AIA, to give some information to our guests.
Yeah, absolutely. So I'm AIA Australia's National Vitality Coach. My job, I love what I get to do. My job is to speak to people about how they can live their healthiest, happiest lives possible. So I'm super passionate about all things to do with health and well-being, including mental health, physical health, nutrition, all the things that go into it. So I was traveling the country speaking to advisors like yourself, Sam, and also clients, but now I'm doing it from the comfort of my lounge room, speaking about something that's really, really important, health and well-being. Okay, excellent.
Sasha, I've noticed that insurance companies today are offering discounts for completing certain activities. Can you sort of provide some information why they're actually doing this, and how does these offers provide benefits in terms of premiums as well?
Yeah, absolutely, Sam. It's a really good question, and one that I puzzled over before I joined AIA and took on this role as vitality coach. Why would an insurance company promote a health and wellbeing program to their clients? What's all that about? And basically it comes down to a wonderful concept called shared value. We know from many, many years of research, the vitality program has actually been around for over 20 years. We know from many years of research that if we incentivize people to actually take care of themselves, to engage in their own health and wellbeing, to make some changes to their health, they're actually healthier and happier, which means we have a book of healthier, happier clients. And for our advisors, similar for them, they have a book of happier, healthier clients. For an insurance company, what that means is we get to keep people healthy for longer. They're less likely to go on claim, and if they do go on claim, they do get to come back to their reality a lot quicker. So we know that investing in Australians' health, if we encourage them to think about their nutrition, to think about their activity, and to think about their mental health, and incentivize them to do that, they will actually improve in many areas of their life. And that's ultimately what we want. AIA's massive vision is to have Australia and New Zealand as the healthiest and most protected nations in the world. And the AIA Vitality Program really lends itself to getting us to achieve that vision.
Okay, so looking at having access to research, as you've mentioned with the program, how has the program provided benefits to clients?
Yeah, it's incredible. Obviously, we've invested a lot of money to bring the AI Vitality Program over to Australia, and we wouldn't have done that without the research that you've alluded to. What we do know is if people engage in the Vitality Program, they actually get to increase their lifespan, if that makes sense. So they reduce all their risk factors. So we talk about BMI, blood pressure, high blood glucose, all of those things that go into making someone a healthy person. If any of those factors are out of whack, then they increase their risk of developing quite a chronic disease later on. So we know that from our research, for those people that engage in the Vitality program, they actually reduce those risk factors, which then also means they reduce the risk of developing those diseases later on. We know, for example, if someone was a 55-year-old gold status Vitality member, they actually have the same mortality rate as someone who is a 36-year-old person not taking care of their health. So that's quite incredible when you look at it that way.
That's wonderful.
We also know that if people do get sick and they are engaging in the Vitality program, they spend less time in hospital, they spend less money on medications, and they actually return back to their normal a lot quicker. So if they're coming from a healthy base and they do happen to get sick, they're more likely to get better a lot quicker than if they're coming from a base that's not so healthy.
Yeah, most definitely. Now, obviously, during the lockdown, we've got a stage 4 lockdown in Victoria due to the COVID-19. There has been an increase in alertness to mental health, and there's been reports of increasing people making claims or also seeing a doctor, and unfortunate circumstances. How can people today, what are some simple things they can do to sort of protect themselves from, being in that situation?
Yeah, it's a great question, Sam, and one that we're really passionate about at AIA. What we do know is that intrinsically people know what they need to do to take care of themselves. We know that we need to choose healthy foods more often than not. We need to get out and exercise when we can, and we need to be really mindful of our mental health. Unfortunately, though, as humans, it's almost like a design fault. As soon as things start to feel a bit heavy and out of whack, and our stress levels go up, our default method is not necessarily to reach for a salad or go out for a walk or a run. It tends to be more leaning towards the fast food, maybe drinking a little bit more and collapsing on the couch to binge Netflix for the next 4 hours. So what we do try to encourage is to really highlight those areas in our life that we can have some control over when it comes to mental health. There's many factors that we can't control. Previous history of mental health, family history of mental health, gender. There's a lot of factors that we can't control, but there are so many factors that will really make a big difference that are within our control, and it is focusing on those elements. So being mindful about what we eat, making sure we exercise, doing what we can do to take care of our mental health. So that's sleeping, that's stepping away from devices before bedtime, not spending too much time on social media accounts that are causing angst or stress, and really recognizing those triggers, those individual triggers that we all have when things start to get a little bit heavy. The great thing, as you and I spoke about briefly before, was when we first saw that lockdown happen back in March, people were aware of what they needed to do to take care of themselves. We saw an uptake of people shopping for groceries more. They spent more money on good food rather than ordering takeaway. We saw a massive increase in downloads of fitness activities that people can do from their homes. And most of us are aware that places like Rebel Sport and sporting places actually sold out of their home equipment. Then what we did tend to see was a little bit of compliance fatigue. So people were starting just to get a little bit over the same thing all the time. So we need to be able to find a way to encourage people to continue to implement those healthy habits. And a great way to do that, based on behavioural economics, is incentivizing people to make those choices to be healthy more often than not.
Yeah, definitely. Great answer. Thanks for that. In light of what's happening today, there's a lot of fear and uncertainty about the future in relation to the economic situation. Health obviously takes a backseat to that, with what people are thinking. Is there one thing that you can give our audience that should really focus on?
Yeah, absolutely. So look, movement is key. Movement, we know now that movement actually has more positive benefits for our mental health than it does our physical health. So obviously there's the gift with purchase, that if you get out and you're exercising, then physically look and feel great. But we know that the impact that it has on mental health is incredible. So movement really is the key. And as you said, in Victoria, we're allowed out for an hour every day to exercise. I can't stress enough how important that is. Getting outside, getting whatever vitamin D is out there at the moment, getting some fresh air, some oxygen, and just moving. I know myself, you know, I'm sat behind my desk working away as everyone is, and I've had moments where I could have just put my head on the desk and had a quick nap, but, you know, it just didn't feel great. It takes a lot of effort to actually get up out of the chair and get outside and go for a walk, but the return on investment in that is just incredible, and we can't underestimate how important movement is. And we also know that if people move more, they tend to think about other elements of their life to be healthy as well. So if there was one thing that I would encourage people to do, it is just get outside and move in whatever shape or form that looks like. You might crank up the tunes outside and have a little disco party yourself, have a little dance outside. Some people it's about going for a sprint. Other people it's just simply about walking. Whatever that looks like to you, I can't stress enough how important that is.
Sure. Yeah. Thanks very much. We really appreciate your time discussing these really important matters with us.